Good evening. The emergency departments at 3 of Adelaide's major hospitals have buckled under the weight of incoming patients, forcing ambulances to be turned away or ramped outside. Authorities blame an unprecedented flu spike, but the ambulance union says an urgent fix is needed.
Monday morning meltdown as Adelaide's metropolitan emergency departments fill to capacity and beyond.
They're all bursting at the seams. They've got a problem, we don't deny that at all. And we're sympathetic to their problem, we're just not sympathetic to their solution.
That solution, ramping. The Royal Adelaide this morning moving into what's known as Phase 4.
Keeping patients in ambulances rather than taking them in the ED.
Our healthcare system has unprecedented levels of activity. Our emergency departments are a part of that.
SA Health says 2 patients were left in ambulances at the REH for no more than 35 minutes. Delays too at the Queen Elizabeth Hospital and Flinders Medical Centre, with some ambulances diverted to Noarlunga Hospital.
The cancer's now spreading to most of the other major hospitals as well.
Yes, it is an in-hospital management problem, which they're choosing to push out the door and make it an ambulance service problem.
Authorities blaming a flu spike which soared in the past week and could worsen.
We had 900 reports of influenza in our community, and that is unprecedented. We haven't seen those numbers for quite a few years.
But what we don't know is this is the new normal.
SA Ambulance trialling a new approach, contracting 2 private ambulance operators for occasional non-urgent cases.
Using a third party to contract essentially what we call patient transport
is a form of privatisation in this union's view.
And Tom Richardson joins us live now. Tom, just how dire was the situation today?
Yeah, Brenton, it was bad across the board here at the Royal Adelaide. Of course, patients were kept waiting outside the ED. 4 ambulances at Flinders and 3 at the QEH were also kept waiting for various periods of time. And while authorities blame a bad winter, many insiders now fear this ramping situation has become a systemic problem. It's particularly susceptible on a Monday because of a backlog of patients from the weekend when many consultants just don't work. So the questions the ambulance union now wants answered: is this now the new normal? And if so, what can the government do about it? Back to you.
Thank you, Tom.